So it's great to see everyone here this morning at our third HEA Health and Wellbeing Conference. For those of you who don't know me, my name is Ross Woods. I head up the HEA's policy work on health and wellbeing and also on teaching and learning enhancement. My colleagues will welcome you formally, but I'll just briefly mention some pieces of housekeeping. We have a fairly packed agenda, and I'll be trying to keep strictly to time, although I've failed in that slightly already. As Tim says, I've less than 5 minutes left. The running order is I guess, as follows. We'll start with our first keynote address, then we'll have a break for coffee for half an hour. We'll then have 3 presentations before lunch at 12:30, which will again be down at the other end of the corridor, where you will have had tea and coffee just now. The afternoon session begins at 1:15 p.m. with our second keynote, and we'll run through till about 4:15 with a couple more presentations and some lightning talks on best practice from around the sector. The conference, as I said, will finish around 4:15, and I encourage you all to stay till the end, because we're delighted to have the Minister for Further and Higher Education, Research, Innovation and Science coming to deliver the closing remarks, which I think is quite significant for us who are working in this particular space. If you just familiarise yourself with the emergency exit, it's behind you there, so if you're sitting at the front, try not to run. The toilets, there are toilets out in the corridor here, just behind us, and there are more down beside where the tea and coffee stations are. If you do have any questions, just approach one of the HEA staff who are either positioned at the registration desk or myself and Caroline are around too. So I'd like to invite Caroline up to say a few words. Caroline is our HEA National Healthy Campus Coordinator. Unfortunately, this will be one of Caroline's final acts in this role, as she is moving on to pastures new in the HEA at the end of the month. So I'd just like to say a heartfelt thanks to Caroline for all the work that she's done and invite her up. Thanks.
Morning, everyone. I think most of you probably know me at this stage, but just as Ross mentioned, it's my last engagement. I feel like a politician saying that, maybe. So I move into a new role in the HEA. So look, it wasn't an easy decision, but I think what's really important is having a national role, and that role is made possible by a strong partnership between the HEA and the Department of Health, which for me is just real systems in action. So it's real health promotion at a senior level, at a governance level. And I know I say that all of the time, but really the role is just, like, we're so lucky in Ireland to have national administration when it comes to Healthy Campus and then obviously our national policy. So, however, no national role is of any use if we don't have a network of leaders and advocates, which includes all of you in the room here today, as well as others across the system. So without all of you, we wouldn't have a Healthy Campus Charter and Framework. So we wouldn't have today's event. We wouldn't have a self-evaluation tool. We wouldn't have a Healthy Campus open course. We wouldn't have hosted the second ever International Health Promoting Campus Conference or developed the Limerick Framework for Action, putting Ireland on the global map. One of my favourite things across the 4 years has been about baking in and not bolting on health and wellbeing. So may you all continue the baking in. Finally, I'd like to say a heartfelt thank you to my colleagues in the HEA. This was a new role, so I started and was like, what are we doing? Where are we going? And Ross and Tim and others across the HEA really took on board, the messaging and the principles of health promotion, and I think we've shaped things up really well. So I'm really proud of the work that we've done across the 4 years. So now I'd like to I should name my HEA colleagues, so I skipped that bit. So I'd like to formally thank Ruth McLaughlin, Erin Brown, Ross Woods and Tim Conlon. And I'd like to formally introduce you to Tim Conlon now, who's Head of Policy and Strategic Planning at the HEA. In recent years, Tim has been a key driver of the HEA's policy work on health and wellbeing and has been instrumental in forging strong relationships with colleagues in the HSE and Department of Health. He led the development of the National Student Mental Health and Suicide Prevention Framework in 2020 and oversaw the HEA's adoption of the Healthy Campus Charter and Framework in 2021. I also vaguely remember seeing Tim at those early consultation meetings between key stakeholders across the sector and the Department of Health when we were creating the Healthy Campus Charter and Framework. It rolls off the tongue, that one, so I always end up saying the full thing. Tim has also been a central figure in the recent development of the Irish higher education system, including the development of the TU sector and the delivery of new HE programmes in dentistry, pharmacy, medicine, nursing and veterinary. So we welcome Tim.
Thanks, Caroline. That's quite an introduction and probably not that well deserved. Can I open by acknowledging the role of partnership between the HEA and the Department of Health, as Caroline has said, and the strong support we have received from all involved, up to and including Philip Dodd, who will address us later today. As Caroline said, this is our 4th Health and Wellbeing Conference. We had supporting success through wellbeing and higher education in 2023, a whole-of-institution approach to health and wellbeing in 24, the International Health Promoting Campuses Conference in Limerick in 2025, which was a wonderful event, and now we're here today to think about global perspectives and an opportunity for Ireland's leadership in transforming healthy campus policy. So, at national level, the HEA has a strong track record in promoting student health and wellbeing, and there is no question as to our commitment to this important agenda, nationally and internationally. In 2010, we launched the first National Student Mental Health and Suicide Prevention Framework. We were one of the first countries in the world to do so, and we're currently in the process of renewing and updating that framework. In 2021, we took over the implementation of the Healthy Campus Charter and Framework across higher education institutions with the support of Healthy Ireland. As you will know, the Healthy Campus Charter and Framework was co-created through a consultative process by higher education institutions, Department of Health, HSE, and we look forward to continuing those fruitful and collaborative relationships. Our higher education institutions have played no small part in progressing this programme too. A look at our agenda today, or indeed any of our past events, demonstrates the expertise, support and willingness that we've had available to us over the last 5 years. We've had the support of multiple ministers who have participated in our events and supported our work, including Minister Lawless, who will address us later today. Hong Hui Lang, writing on influencing factors in students' well-being, suggested that by aligning educational practices with positive psychology, institutions can cultivate flourishing students poised to thrive academically and personally. At this stage, we all know that well-being is good for business, and higher education, like it or not, is a business in a way. We know that student health and well-being, and indeed belonging, sense of place, of being connected, is ever more important in building and retaining resilience in what is becoming, or has become, a very complex world. So what our shared movement and the Limerick Framework for Action call for now is a continuity of that action. In Ireland, we want to encourage this, to participate and support the work and the work of the International Health Promoting Campuses Network. The Limerick Framework serves as a guiding tool for us all, empowering action rather than prescribing it, which is the way we like to do policy in higher education in Ireland. We see the framework as supporting the HEA in promoting institutions and promoting national health and wellbeing policy too. For example, the pre-conference workshops yesterday on scoping online learning resources facilitated by Spun Out and advancing health promoting campuses applying the Limerick Framework facilitated by University of Limerick are there to assist us all. I thank the leaders, facilitators and participants for progressing our shared vision in that way. The workshops, today's agenda and all our work has a strong alignment to the Limerick Framework's 10 actions, including themes such as planetary well-being, the World Health Organization's One Health agenda, student belonging, as I've mentioned, building agency, and relationship-rich cultures, curriculum, partnerships, and so on. Many of these areas we will hear about and speak about later today. But we're not an island. Actually, we are an island, but anyway, that's it. What I want to say is that action is important locally and nationally. And we exist in a world with lots of opportunity for European and global partnerships. So I'm really delighted that we're joined virtually and supported by colleagues across the world, including the United States of America, Canada, South Africa, Tanzania, France, Italy and Switzerland, and also representatives from organisations including UNESCO. We are delighted to have representatives from Canada to deliver two of the keynotes today. Dr. Vicky Squires from University of Saskatchewan and Dr. Jennifer Tannhauser from University of Calgary are here today to speak to us. Our second keynote speaker is our own Deputy Chief Medical Officer, Professor Philip Dodd, who has been a great supporter of our work in the higher education sphere. And I'm delighted that he's here too. So, to finish, a quote from the Limerick Framework, which reminds us that we should seek to support existing and foster new, change-focused partnerships with organisations and apply knowledge and learning for the co-benefit of students, employees and communities. Thanks for your participation and contributions today, yesterday and every day. Thank you.